Explain this to us. What do you mean by
Yeah,
this?
it's interesting. You know, if you look at this map, that shows the difference in urban areas and more rural areas. And basically, what it shows is that people living in urban areas are less likely to die prematurely. That's in part because they have better access to healthcare facilities and recreational areas. So it's interesting. I mean, you can actually predict this.
Now, you mentioned a couple of factors. There are other factors that attribute to this?
Yeah, people also who live in rural areas have higher rates of smoking, obesity, child poverty, teen births, as well as higher numbers of uninsured adults than their urban counterparts. So lots of interesting stuff.
And they're attributing that to what? I mean, some of that makes sense, I guess.
Yeah, you know, if you have more access to healthcare, I think you do well. And then the smaller populations of rural areas means, guess what, fewer businesses, fewer taxes, and fewer resources, which have a significant impact on health. Plus, an older population generally makes up rural areas. So interesting stuff.
Well, is there any kind of cure for this if you live in the wrong place?
Yeah, so what solutions do we have? My prescriptions, here we go. You know, first, increase access to mental health services. We desperately need it for people struggling with addiction. Drug overdose and deaths have increased, guess what, 79% nationwide since 2002. We can save lives also by tracking prescriptions, safely disposing drugs, and increasing access to prescription medicine that can reduce overdose, and more training of first responders on how to administer those drugs. And also increase the amount of sleep. We talk about sleep all the time in the show. A third of adults don't get enough sleep, and the lack of sleep can lost productivity, stress, depression, and motor vehicle crashes. Lastly, reduce residential segregation. People living in segregated neighborhoods experience greater stress and higher incidence of illness and death. And be the change. Join your local PTA and get involved in your neighborhood association. Do something. Encourage your employers to offer workplace wellness activities. You know, so all these things will make a difference.